The Ebola outbreak in the Eastern Democratic Republic of Congo and its spread to the dense population center of Goma underscores a real risk of a spike in the disease, perhaps beyond the borders of the country. That's the warning issued in a joint statement by the United Nations, the World Health Organization, the UN's Children's Fund and the World Food Programme to mark Thursday's one-year anniversary since the DRC government declared an Ebola outbreak in that country. 2 weeks ago, the WHO declared the outbreak a public health emergency, only the fourth time such a declaration has been made in the organization's history.
Members of the UN Security Council also met behind closed doors in an informal, interactive dialogue and are likely to begin negotiations on a presidential statement and action second only to a resolution on the current Ebola crisis.
The identification of the case in Goma could potentially be a game changer in this epidemic. Goma is a city of 2 million people near the border with Rwanda and is a gateway to the region and the world. We're confident in the measures we're put in place and hope that we will see no further transmission of Ebola in Goma. Nevertheless, we cannot be too careful. I have therefore decided to reconvene the emergency committee as soon as possible to assess the threat of this development.
In the last year, there have been more than 2,600 confirmed cases, including more than 1,800 deaths in parts of Ituri and North Kivu provinces, while 1 in every 3 cases is a child. More than 770 people have survived. Aid agencies led by the WHO say they're mobilizing all aspects of the response to stop the spread of the virus.
Surveillance at all points of entry and points of control in the area are being stepped up. They're also increasing community engagement, risk communications, and active case finding. In a joint statement to mark the one-year milestone, the Director General of the World Health Organization, the Undersecretary General for Humanitarian Affairs and Emergency Relief Coordination, and the Executive Director of UNICEF, as well as the Executive Director of the World Food Programme, issued a joint statement adding that this latest case in such a dense population center underscores the very real risk of a spike in disease transmission, perhaps beyond the country's border, and the very urgent need for strengthened global response and increased donor investment.
UNICEF has appealed for $170 million of additional funding to combat the disease that has affected more than 700 children to date.
Colleagues and communities on the ground are fighting the outbreak tirelessly, but we need desperately international community to back us up. UNICEF will need to triple its budget to respond to this complex crisis. When you're a mother and you have a child that is sick, you don't know if this child has malaria, measles, or Ebola. You need to be able to take care of that child, whatever disease it is. We are in a moment where it could go either way. And that's the moment where we need to do this massive investment to turn this epidemic and to control it.
In a region of the world not just fighting an epidemic, but facing armed groups and insecurity that further complicates response efforts. The United Nations and its partners are calling this a critical juncture in which the international community must reaffirm its collective commitment to the people of the DRC, with a stark warning that because this outbreak is happening in an active conflict zone, violence has prevented their ability to reach communities and work with them through health interventions and education to stop further transmission. Sherman Bryce-Speeds, SABC News, New York.